In this presentation, my group members and I will argue that the Spanish flu prepared America for future pandemics through technology and learning. Americans learned about treatment, prevention, and vaccines, which would all be critical in the present pandemic, COVID-19. You may wonder, what is the Spanish flu? It was a deadly strain of the H1N1 virus that affected over 500 million people. It was extremely fast-spreading, and it killed about 40 million people worldwide, 550,000 in just the USA. It lasted from spring of 1918 to spring of 1920. It can be broken into three main waves: spring of 1918, fall of 1918, and winter-spring 1918-1919. There was a relapse of the virus in spring of 1920, however, this was not thought to be one of the main waves. I would like to make clear how people caught the Spanish flu and how it affected the body. It was passed through respiratory droplets through the mucous membranes, which were the eyes, mouth, and nose. It triggered an overreaction to the immune response that made the body attack its own cells, which included good cells too. It affected lungs the most, and most people died from pneumonia and hemorrhages within the lungs. The damage of the lungs affected the oxygenation of blood, so these individuals basically suffocated to death. In this presentation, we will be focusing mainly on America during the Spanish flu pandemic. And I would like to talk about some of the American life during the start of the pandemic. The leaders were President Woodrow Wilson and Vice President Thomas Marshall. Islam and Christianity were the mass religions, and they saw the flu as a test of their faith in God. Health insurance was available to those who could afford it, and it helped the people who had it, but also the insurance industry itself. Life insurance premiums went up, but civilians were making more off the insurance than they were paying into it. For example, a husband and wife could have bought life insurance one week, and the following week the husband died. The wife would have made a giant profit off of the life insurance because she only paid one premium into it. Hospitals were overflowing, and nurses were the main ones on the front line most of the time. Doctors were taking care of the people who were the most sick. Wave 1. Spring 1918 is when it all started. It was a mild wave and killed 3 to 5 million people. The origin in America was in Kansas and a military base located there. The actual origin was found to be in East Asia. Soldiers were the most affected during the first wave. It spread through Europe during the end of World War I from the American troops. Spain released the pandemic through the press first because they remained neutral during World War I, and the press release was not as strictly enforced. So that's where it got its name from, the Spanish flu, not because it originated there. South America and Australia were minimally affected in the first wave as well. Some of the economic effects during the first wave were small business income was affected by up to 70%, such as clothing stores and drugstores in the area. Telegram and postal delivery declined greatly. Bed and mattress sales increased due to the bed rest prescribed by doctors. Increase in the pharmaceutical industries and hospitals. Life and health insurance companies thrived. Overall, it did not cause the economy to plummet. America seemed to handle the first wave fairly well. They started quickly to try to stop the spread of the virus. Masks were worn by everyone, especially medical professionals and military personnel. They tried to get people to not cough, spit, or sneeze in public. They shut down public places like churches and schools in hopes of slowing the spread of the virus. Social distancing was the number one method of prevention. Complications arose, though. Parades and outside activities in the beginning led to a skyrocket in cases, like the Philadelphia parade that causes cases to soar a week later. Shooting of people not wearing masks out of fear and people refusing to social distance was definitely all complications that came in the first wave. The Spanish flu was definitely different than deaths with previous illnesses. Previous pandemics were killing the elderly, but this flu was killing the young adults, about 24 to 35-year-olds, at an increased rate. It was passed from human to human, not animal to human, like with another big pandemic like the bubonic plague. Faster spreading and attacking the body differently was the reasoning behind the peak in the late 20s and early 30 deaths. In the graph shown, the red line shows the pandemic of the Spanish flu, and it shows the peak of the late 20s and early 30 deaths. The blue line shows illnesses before the pandemic, and it shows the deaths increased in infants and elderly, which was definitely a different thing from the Spanish flu. There really wasn't many treatments during the first wave of the Spanish flu. There was no cure, of course, and doctors were unsure how to treat it and prescribed aspirin up to 30 milligrams in bed rest. This led to complications like aspirin poisoning, and it led to death by pneumonia because of the toxicity. 30 milligrams is extremely toxic after they found this after the pandemic. Recommended was quarantining people for up to 40 days. Medicine started coming out like Bahani and Tenlac, which didn't work. There were no vaccines near ready in the first wave. Richard Pfeiffer had been trying for years to create a vaccine, and he accurately found the bacilli that was causing the flu, also what mutated to the Spanish flu. Dr. William H. Park, head of the NYC Health Department, tried to start to find this vaccine based on Pfeiffer's findings. Health officials relied solely on aspirin and medications already on the market in hopes of slowing the spread of the virus.
The second wave of the Spanish flu took place in the fall of 1918. It was the most infectious and deadly wave. An estimated 195,000 Americans died of the disease just in the month of October. This is because the disease mutated after the first wave, become more deadly. The first outbreak was noticed at Camp Devens in Boston. Many doctors and nurses were overseas in Europe for World War I, leaving America extremely short on personnel and supplies. As with most diseases, cities were hit the hardest, such as Chicago and Philadelphia. The country went into quarantine, shutting down theaters, parks, and making large public gatherings illegal. The overall economy of the United States wasn't affected too greatly during the second wave, as World War I stimulated the economy enough. However, many small and family-owned businesses got the worst of it, not being able to survive the shutdown of the country. Studies have shown that during the second wave, the United States' real GDP and consumption didn't drop more than 2%. In the year 1918, medicine wasn't nearly advanced enough to treat the disease properly, much less ever develop a vaccine. There were no new forms of treatments or medicine developed since the first wave. Many times patients were put outside as a part of the open-air treatment, as well as given painkillers and other non-effective medicines. The military was especially affected by the Spanish flu, as around 20 to 40% of the total troops contracted the disease. 4 camps specifically were affected the worst: Camp McClinton in Alabama, Camp Merritt in New Jersey, Camp Meade in Maryland, and Camp Greenleaf in Georgia. Camp McClinton was hit with the disease on September 20th, 1918. The camp was quarantined for around 2 weeks, on October 2nd to October 14th. Over 4,900 cases and 228 deaths just in the month of October. Recovering patients were often kept in isolation for up to 10 days, and were often sprayed with chemical agents to decontaminate. Camp Merritt was the first to get hit on September 16, 1918. Doctors did not immediately realize how severe it was, as the first outbreak was not that bad. Many nurses and medical professionals that were brought in became very sick themselves, and soldiers had to assist, but had no experience in medicine. By November 1st, 265 of 999 patients had died, roughly a 26% mortality rate. The Spanish flu reached Camp Meade on September 17, 1918. However, doctors at this camp were more prepared than others. Around 800 soldiers were admitted to the ward on September 24th, and the camp was in quarantine until October 20th. Around 11,000 soldiers, or 25% of the camp's population, got sick by November. As many doctors were sick as well, Johns Hopkins and other Catholic nuns trained as nurses to come to the camp. Local newspapers downplayed the flu and made it seem as if there were a lot fewer deaths and infections. The second wave reached Camp Greenleaf on September 23, 1918. It was a medical training site that deployed professionals to other camps. Around 5,000 people were infected at the base, and it had a 6.3 mortality rate. There were 44 German prisoners of war at this camp, all who died from the disease. Despite the camp being full of medical professionals, the camp never closed public places or required newcomers to quarantine. On November 11th, the Great War was finally over, and all the troops began to go home from Europe. American and European countries began to see greater numbers of deaths and infections as people were traveling home and celebrating the war by drinking, going out, and having large parades.
The third wave of the Spanish flu began in winter of 1918 and flowed into spring of 1919. The origin of the third wave was in Australia, which really caught people off guard because Australia did not experience many cases in the second wave due to a strict lockdown. The disease spread quickly over to Europe and through to the United States, affecting mostly major cities. The third wave did add much to the pandemic death toll, but was not nearly as deadly as the second wave. There is a lot less research on the third wave compared to the first and second waves because it was not as widespread across the world. Researchers believe that the third wave was smaller because part of the population developed an immunity to the disease. Illness in the first wave or second wave did not protect society from illness in the third wave. You could have a relapse of this disease. In the United States, there was isolated outbreaks killing tens of thousands of people in the first 6 months of 1919, mostly in Los Angeles, New York, Memphis, Nashville, San Francisco, and St. Louis. Like I said earlier, everyone was very caught off guard when the third wave occurred. After 2 waves, families thought that they were safe to continue having children and move on with their lives. The Spanish flu affected young adults the hardest, which was an issue for families. Back then, most people had children at a very young age, right when they would get married in their young 20s. Pregnant women were at a higher risk of contracting the flu and had worse symptoms in some cases. There was an increase in stillbirths, and the infants that were born were not as healthy as they should be due to the fact that they did not have their mother's breast milk. On April 3, 1919, President Woodrow Wilson was struck with the disease. He became ill right during the Paris Peace Conference. He was bedridden for 5 days, struggling with a high-grade fever and intense cough. President Wilson's peers and staff said he was never the same after he recovered from the disease. Some said he was paranoid 24/7 and was not as sharp as he used to be. He had a stroke in September and became extremely forgetful and loosened up his strong personality.
Wave 4, Spring 1920. 2 years after it all started, when the Spanish flu arrived in spring of 1918. It's still up for debate whether or not the spring of 1920 was an actual quote-unquote wave of the Spanish flu. Life was finally returning to somewhat of a normalcy since the pandemic began in 1918. However, there was a relapse of the virus when a spike of illnesses occurred in locations such as Scandinavia and a series of isolated South Atlantic islands. This caused a lot of fear in the United States because people finally thought this entire pandemic was over, and upon hearing the news of this, people began to think that it would never end. It is debated whether this was even the Spanish flu or perhaps a different strain of the virus. This relapse was affecting young adults much like the prior waves, which is what caused the fear that this was still the Spanish flu and that it was not going to ever go away. It took everyone by surprise because everyone finally thought the pandemic was over and were taken aghast when they realized that it could not be the end. Spring 1920, State of the Economy. The United States economy suffered far less compared to a typical country throughout the pandemic. To put it into perspective, most countries' GDP dropped 6%, whereas the US's only dropped 1.5%. There was still a recession at the start of 1920, as the government and the people were trying to return to a normalcy and get the economy to an equilibrium after a driving force of inflation was imposed on the dollar. For example, a pair of shoes might have cost $3 or $4 back then, and at this time, with the inflation that was inflicted upon the US dollar, that same pair of shoes was costing $10 to $12. The economy was also weak because a majority of the pandemic's deaths were of people between the ages of 20 to 39, an age group that makes up a majority of jobs and workers in America. However, the economy began opening back up and small businesses were in the process of being revived. The economy never plummeted throughout the pandemic, and shortly after it was over, the decade we all know as the Roaring Twenties began, and the economy thrived and grew 42% overall throughout this decade. Spring 1920. Life in America. Life in America during this time period was much like it is today. The economy began to open back up, and people were trying to return to their normal lives before the pandemic. Worldwide, some countries were more open and normal than others. Many countries were still hesitant to open back up due to the fear of another wave. This was all dependent on each country's policies, as some countries experienced more death and seemed more prone to the effects of the pandemic than others. Guidelines for the pandemic were still being encouraged and in some areas enforced. Some of these guidelines were such as wearing masks, social distancing, and not gathering in large crowds. There were spikes in cases at times, which resulted in mandates being put back in place. People were still allowed to go to work and live their lives somewhat like they did before the pandemic began, but these guidelines were enforced and encouraged throughout the country throughout this time period. Spring 1920. Life in America continued. The mass religion of Christianity became a big topic in the United States as well as the world, as the pandemic became to seem like it was coming to an end, and many people thanked their faith in God for that. In the beginning of the pandemic, many people questioned their faith in God or a higher being simply based on the fact that this was happening to them and to the entire world. As it seemed like the pandemic was coming to an end, many people who stood fast in their religion thanked God and thanked themselves for their faith in God to get them out of these hard times. Hospitals were still busy with patients who contracted the virus, but nowhere near as busy as they were during the initial waves of the virus. This was mainly because the curve was flattening, and most people had recovered and built an immunity. Spring 1920. Treatments. Treatments varied from newly developed drugs to oils and herbs. Some of these drugs had no definitive results, but in theory were supposed to reduce the severity of the symptoms from the Spanish flu. Aspirin was still a common remedy used to reduce fever or pain. For secondary pneumonia, epinephrine was given to patients. Patients also received oxygen by mask to combat the discoloration of their skin that came from them not getting enough oxygen and their airways not being clear enough. Their skin usually turned blue or purple. Salicin was also used to reduce pain, discomfort, fever, and some claimed it even helped reduce the infectivity of some patients. Some patients received blood transfusions from recovered patients, which seemed to help in a small percentage of the cases. And obviously, plenty of fluids and bed rest were advised, as per any illness. Spring 1920. Vaccine. No vaccine was available or even close to being ready by this time. Many scientists conducted studies and trials, but there wasn't any success. It wasn't until 1942 that a vaccine was developed, and the use for civilian population was not approved until 1946. Before 1942, the race to make a vaccine was participated in by doctors across the world. In 1892, Richard Pfeiffer proved endotoxins played a large role in infectious diseases after discovering them in an astonishing number of influenza patients after the 1890 pandemic. Many doctors used this research to try and create a vaccine for the Spanish flu. Trials were conducted and claims of success were made, but none produced results with enough confidence to distribute to the public. It took 24 years for a proven and effective vaccine for all to be developed.
The Spanish flu prompted people to focus on deadly viruses and how they can better prepare for the next. Some methods for this preparation included an increase in hygiene and cleanliness, treatments and vaccines, economy related to setting money aside for such expenses, and quarantines. After the Spanish flu, the medical field knew that they needed to start preparing and educating future medical professionals for the next epidemic. They knew this would not be a one-time occurrence, especially after experiencing 3 waves of the Spanish flu. Many epidemics occurred after the Spanish flu, but were controlled better due to the formation of the World Health Organization, also known as WHO. Some of the epidemics that occurred post-Spanish flu was the Asian flu, Hong Kong flu, the HIV/AIDS virus, SARS, Ebola, and most recently COVID-19. The main focus of our next few slides will be on the Asian flu, HIV, and COVID-19.
And now we are going to be talking about the Asian flu. It is an H2N2 virus that originated in East Asia in 1957. It was very infectious and killed around 1.1 to 2 million people in the world, with 1,600,000 in the United States. Diseased people would experience wobbly legs, chills, sores, runny noses, coughs, achiness, and high fevers. It was spread like the Spanish through mucous membranes. Many survivors of the Spanish flu actually showed antibodies to the Asian flu as well. Microbiologist Maurice Hellman, who had worked on the vaccine before, took initiative and started rolling out vaccines in the late July of 1957. This allowed the halt of the disease, with 40 million doses being made that year. The United States was scared of another downfall like the Spanish flu, which made them act quickly, and Hillman said by bypassing the bureaucratic red tape, he could work in contact with the manufacturers and push it out quicker. Now we're going to talk about HIV and AIDS. HIV is a virus that affects a person's immune system by attacking the cells in your body that help prevent sickness. The first case was not reported until 1981, however, people believe it was around for a while. AIDS originates from not getting treatment for HIV and has life-threatening damages to your immune system. Around 32 million people have died from it. It's transmitted from person to person, blood, semen, preseminal fluids, rectal fluids, vaginal fluids, and breast milk. Some symptoms of infected people are fevers, chills, night sweats, achiness, sore throat, fatigue, swollen lymph nodes, and mouth ulcers, while some don't experience any. If left untreated, it was seen as a death sentence in the next 2 to 10 years, a while ago. Travel to the United States without citizenship was banned from 1987 to 2010. There is currently no vaccine available for HIV/AIDS. HIV treatment is now just known as medicine to help the virus get under control by decreasing the amount of HIV in a person's blood. And now we're going to talk about COVID, which hopefully I think you might know. So it is a respiratory virus that is caused by SARS-CoV-2 in 2019. SARS-CoV-2 comes from a rat, and we believe it was started in Wuhan, China. There have been 141 million people affected so far, and about 3 million have died. Only about 567,000 in the United States. The first case came to the United States in mid-January of 2020, and WHO declared a global pandemic on March 11th. Now we're going to talk about how people caught it and how it affected the body. So, it was transmitted through respiratory droplets, including coughing, sneezing, breathing, just particles that you'd put off. Diseased people would have symptoms for 2 to 14 days that would include fever, cough, trouble breathing, fatigue, achiness, sore throat, headache, nose problems, loss of taste or smell, vomiting, and diarrhea. It can also cause a person to get pneumonia from coughing and throwing up. Some complications have made people have to get on ventilators to help their breathing. Pre-existing medical conditions also increase your probability of infection, as well as being older. American lifestyle changed a lot during this pandemic. Quarantine was one of the bigger changes to American lifestyle at the time. Many Americans, mostly young people, had a hard time not going out and secluding to their homes. Other countries implemented very strict quarantine rules, which helped slow down infection rate in their countries. Travel to or outside of the U.S. was banned as well for some time. Small businesses were shutting down from the dip in the economy, and only essential stores were open in the beginning. Everything went online from schools to jobs, and we put in mask mandate laws, and everything must be 6 feet apart from each other. There has been considered 2 waves of the COVID-19 so far. The first ranged from March to June of 2020. Many did not know it was a thing until the first wave hit, and we were all in shock. Everyone was unprepared and didn't take it as serious as we didn't know what came from it. We did start introducing the 6 feet rule and mask. In wave 2, it was from September to December of 2020. People believed that quarantine worked and we just wanted to go back to normal life, so people started doing so. This resulted in a spike of cases, and it made us more prepared on how to handle the situation. Because of our history, we now prepare differently for these types of things. For awareness, when a threatening disease has become present, the world now has been put on notice to get the word out and stop the first big spread. For hygiene and cleanliness, masks are ready and cleaning off anything you use. For treatments, we are very more advanced than back then and know it's important to find quick treatment and efficiently, but know that the nurses and doctors might get sick. In the economy, we had to do stimulus checks in place to help the economy stabilize itself with more money circulating into the market. For the vaccine, produce it, test it, get it out to the public, the most susceptible first, as quickly as possible. For quarantines, the main way to halt a spread is to distance yourself from others so there is no chance to get infected or infect others. There was a huge economic effect to COVID-19. It brought down the economy to the lowest it has been for a while, with businesses only going under. People were saving and not putting money into the economy. Only essential stores were open. And then we had the introduction of stimulus checks. Unemployment rate went up at high times, almost reaching a high of all. And we had an increase in essential workers needed due to nurses and doctors getting sick. The treatment and vaccine. The first vaccine was created in December of 2020, and there are now 7 different types of vaccines available to the public. We are sending them out in waves for people who are most susceptible to the disease to get vaccinated first. And there are also 2 doses a person has to get, and we are not sure how long the vaccine will keep the body immune so far. The history of the Spanish flu helped us in many different ways. Just like the Spanish flu, people during the beginning of COVID-19 were having a hard time socially distanced and insisted on a quarantine while adding mask laws. It helped us know the importance of getting a vaccine quickly but safely. And we also knew how packed hospitals would get, and we had a cruise ship in California for sick patients. The second wave of the Spanish flu was the hardest wave and helped professionals understand the reason and how to calm down or halt COVID's second wave.
To wrap up the presentation, I would like to say that the Spanish flu taught people how to treat and prevent viruses like it. It taught us how to create vaccines and protect our bodies through introducing antibodies for these viruses so it is easier to fight off if we were to catch it. We gradually perfected safety measures and treatments by technology and learning from first-hand experiences through viruses like AIDS and the Asian flu. With COVID-19, we were able to treat and vaccinate people around the world in less than a year, given our prior learning experiences. We expect that we will learn more from COVID-19 and we will be even more prepared for the pandemics to come.